Ramandeep Sahni. I am the Director of Neurology at Phelps Hospital as well as the Stroke Director at Phelps Hospital. I am the Regional Director of Ambulatory Stroke Care in the Westchester region for Northwell Health. Overall, women live longer, and we know that the risk of stroke increases with age. So overall, the lifetime risk of a woman suffering a stroke is much greater than a man. But when we look at certain ages, most of the time men at various ages have greater risk than women, except after a pivotal point after the age of 85. Then we start to see a marked increase in the risk of stroke in women. Stroke does manifest differently in women, but I will emphasize that the most common symptoms related to stroke occur in men and women. But a third of women are more likely to have what we call the atypical stroke symptoms, such as suddenly feeling confused, suddenly feeling generalized weakness, having intractable hiccups, just feeling dizzy very suddenly. These are atypical stroke symptoms that are far more common in women than men. The most common symptoms in stroke is represented in the mnemonic B fast. So B stands for a sudden impairment in balance. E stands for a sudden impairment in vision. F stands for a sudden impairment in facial weakness. A stands for sudden impairment in arm weakness. And S stands for a sudden impairment in speech. The T is to signify how important time is to recognize these symptoms and get medical attention readily. Unfortunately, women have a greater risk of death with stroke. And if they do survive a stroke, they also have a greater burden of disability. Women are more likely to have a stroke at an older age. At that age, we're far more fragile. And so the chance of death is much higher in a woman compared to a man, and the chance of long-term disability is greater in women as well. There's no difference in these treatments offered to men and women, but because women tend to have more atypical stroke symptoms, they may not be recognized readily and they may not seek medical attention readily, so they don't actually receive these acute treatments for stroke that specifically aim to reduce the chance of disability and death. Hormonal changes do have an impact for women specifically throughout their lifetime. During our younger years, many women will be taking oral contraceptives, and these oral contraceptives increase your risk of stroke minimally. But when you compound the use of oral contraceptives with additional risk factors such as high blood pressure, smoking, or if you have a propensity to form clots, adding a birth control agent can markedly increase your risk of stroke. Pregnancy also, there is a slight increased risk of stroke. Pregnancy is a dynamic time in a woman's life where you go through changes in terms of the amount of fluid in your body, various protein levels change, certain antibodies can be produced in response to the pregnancy. That's why it's so important for pregnant women to have regular checkups throughout their pregnancy to check for certain risk factors that might occur, such as high blood pressure during your pregnancy, gestational diabetes during your pregnancy. Making sure these risk factors are adequately treated will reduce your risk of having any adverse outcomes related to your pregnancy, as well as increase the chance of having lower adverse outcomes with the baby. Menopause is another pivotal time in a woman's life. And what we know about menopause is as we see another fluctuation in our hormones, that's when we see a marked rise in certain risk factors for stroke, such as weight gain, high blood pressure, cholesterol, diabetes. There seems to be a threefold increase in these risk factors after menopause. Because women are less likely to receive some of the acute treatments for stroke intended to reduce disability, they are left with more severe neurologic deficits, more disability. With that comes the risk of having depression, severe pain. They tend to be more isolated and not have the same support. Because they're having strokes at an older age, they don't have the same environmental support they should to recover from such a disabling disease. Women of color are particularly more susceptible to stroke for many reasons. One of them is access to good medical care and regular care, that they are readily identified to have certain risk factors for stroke. And then women of color, if they do realize that they have certain risk factors such as high blood pressure, cholesterol, and diabetes, are less likely to be prescribed the medications that they need. Then the third reason is that women of color who are prescribed medication for these risk factors, are these medications optimized to reach the pre-specified goals? And so we need to educate women of color that be aware that you are at particularly risk of stroke, know the risk factors associated with stroke. If you have these risk factors and are prescribed medications, make sure you have this conversation with your doctor. What are your goals with these medications? Make sure that in addition to taking these medications, you have a discussion about lifestyle changes that you can make, and make sure you're aware of the signs of stroke so that you can get care readily if you experience stroke symptoms. The best way, in my opinion, for a woman to protect herself from having a stroke is be aware of your risk factors. One, as a woman, you have an overall greater lifetime risk of a stroke, and this risk will change throughout your life. Making sure you have regular medical care to screen yourself for these risk factors. Making sure you realize that yes, you know the most common symptoms of stroke, but you're also aware as a woman that you may have atypical stroke symptoms. So if you experience a sudden change in your bodily function, that may be enough for you to realize that something has changed and you need to seek medical care. Finally, making sure you have a good conversation with your medical providers about your risk factors for stroke, the medications you need, what are the targets you're trying to achieve with these medications, and what additional lifestyle changes can you make that will help reduce your risk of stroke.